Nursing Assessment, Auditory Systems, Chapter 21, Lewis Textbook. This is a review from class. The auditory system consists of peripheral and central systems. The peripheral system includes the external, middle, inner ear, and is involved with sound reception and perception. The central system, brain and its pathways, integrates and assigns a meaning to what is heard. Normal changes with aging make it more difficult for older adults to filter out unwanted sounds, so a quiet environment should be used for teaching. A loss of sensitivity for high-pitched tones is lost with presbycusis. So education with a patient with mild presbycusis should include both discussion and handouts. The American Tinnitus Association has a good definition of tinnitus. It's the perception of sound when no actual external noise is present. Patients will say they have ringing in the ears, but it can be different for other people. Some might say they have buzzing, hissing, swishing, and clicking. Some patients report hearing music, and tinnitus can be both acute or a chronic problem. That's why some patients with tinnitus will use masking techniques, like playing a radio to block out the ringing in the ears. The pain of a temporomandibular joint is often described as a dull, aching pain that comes and goes in the jaw joint and nearby areas. The TMJ Association discusses ways to help people deal with TMJ pain. First, they need to eat soft foods. They can use ice packs, avoid extreme jaw movements like yawning or chewing gum, and short-term use of over-the-counter or prescription pain medications may also provide relief. They need to avoid treatments that cause permanent changes in the bite or the jaw. This would include like crown work, bridge work, orthodontics to change the bite, or grinding down teeth for a bite adjustment. Questions to probably ask is, do you grind your teeth at night? Are you ever dizzy when you're lying down? This would be helpful to obtain information about other ear problems like vestibular disorders and referred temporomandibular joint pain. Listed here are examples of medication that can damage the ear. Usually the first sign of ototoxicity is tinnitus, and then developing hearing loss or balance disorders. Ototoxic medications can damage the sensory cells used in hearing and balance, and these cells are located in the inner ear. Hearing and balance problems caused by these drugs can sometimes be reversed when the drug therapy is discontinued. Sometimes, though, the damage is permanent. This slide just does a quick review of ear abnormalities. If you're going to use a speculum to check the ear, make sure it's smaller than the ear canal so that you can insert it without damage into the external ear canal. Now, a blue-tinged tympanium can occur with acute otitis media. This requires immediate care to prevent perforation of the tympanum. This is a quick review of the diagnostics. The Rennie test is a hearing test using a vibrating tuning fork that is held near the ear and held at the back of the skull. This test compares air and bone conduction hearing. With the Rennie test, a person with a normal hearing will hear the tone of the vibration longer and louder when the tuning fork is held next to the ear as opposed to when it's held against the mastoid bone. The test detects a hearing loss when a patient hears a louder, longer tone when the vibrating tuning fork is held against the mastoid when it's held next to the ear. For the Weber test, the sound is heard in or lateral to one ear, indicates either a conductive loss in that ear or a sensorineural loss in the other ear. Conductive losses may be due to a buildup of wax, cerumen, an infection of otitis media, or a perforation of the eardrum on the affected side. Lateralization is not associated with normal aging, so the volume of the sound vibrations conducted through parts of the skull and face during the Weber test can indicate which ear may have the hearing loss, and it's noted if the patient hears a louder sound vibration in one ear compared to sounds picked up by the opposite ear. Pure tone audiometry is a hearing test used to determine the presence or absence of hearing loss and determines the faintest tones a person can hear at selected pitches or frequencies starting from low to high. The whisper test is that you should stand about 1 to 2 feet behind the patient so they can't read your lips. The patient should place one finger on the tragus to obscure the sound. As the nurse, you're going to whisper 2 distinct syllables toward the patient's ear. Ask the patient to repeat the words back. Repeat the test for the other ear, and the patient should correctly repeat these 2-syllable words. Electrocochleography records electrical potentials generated in the auditory nerve and inner ear in response to sound stimulation, and electrodes placed in the ear canal, or it could be placed in the tympanic membrane. Function of the brainstem or cerebella, and diagnosis of auditory neuropathy. Auditory evoked potentials. These are used to help diagnose nervous system problems and hearing loss, especially in newborns and children. It gives information to find out how well the nervous system is working, and checks the hearing ability in people who cannot do other hearing tests. Abnormal results could mean brain injury, tumor, or speech disorders. Tympanometry is done to help diagnose several things: hearing loss, fluid in the middle ear, otitis media, and a perforated tympanic membrane. The next four are dealing with vestibular function. This one is the cold calorics, or vestibulo-ocular reflex, or ocular vestibular reflex. An ice water caloric test can show if the patient has an intact brainstem. Now, patient has to have an intact tympanic membrane in order to do the test. It's more powerful in showing eye movement and indicates cerebellar or brainstem lesions. The head of the bed should be elevated to about 30 degrees, and the physician would slowly inject ice water until nystagmus appears. Usually about 200 ml of ice water is used. If the patient is unconscious, the eyes will move toward the irrigated ear and remain there for 2 to 3 minutes. This is used for brain death criteria, because if there is no response, then they're going to check other reflexes to determine if a patient is brain dead. They're going to check the gag reflex for 11 and 12. Pupils 2, 3, 4, and 6 for the cranial nerves. Ears need to be free of significant wax or any clotted blood, which may diminish their response to the cold caloric stimulation. Any movement of the eyes would indicate that some brain pathway is intact. I do not recommend doing a cold caloric on an awake patient because they'll probably vomit all over you and then punch you. Electronystagmography. This is a test that looks at eye movements to see how well the vestibular nerve, which is cranial nerve 8, runs from the brain to the ears, and the oculomotor nerve, which runs from the brain to the eyes. You want to tell the patient that the cold water in the ear could be slightly uncomfortable, and brief dizziness and vertigo might occur during the test. This test is done if a patient has hearing loss due to ototoxic meds or experiences vertigo and dizziness. Remember that vertigo is feeling more like you're spinning, but you're not moving, whereas dizziness is kind of a lightheadedness. Unsteadiness is a sense of imbalance, and that could be called disequilibrium. Posturography. This provides information on a patient's functional ability to maintain their balance. The patient would wear a harness to prevent falls and stands on a platform surrounded by a visual field. By changing the angle of the platform or changing the visual field, the test assesses the movement coordination and the sensory organization of their visual, somatosensory, and vestibular information that relates to the postural control. The Rotary Chair testing is used to test vestibular function. This is done if the patient complains of dizziness and nausea that may suggest a disorder of the labyrinth. Remember that labyrinth controls balance and contains 3 semicircular canals in the vestibule. Problems with balance related to vestibular function may present as nystagmus or vertigo and indicate an increased risk for falls, so be sure they have someone with them when they're ambulating.